My name is Robert J. I'm a former clinical teaching fellow at the University of Leicester, and I was also a student here. I've been asked today to just talk through how we might approach answering some of the first questions that you will encounter using the body logistics course. And the first of these questions relate to body temperature. So let's think about how we could get some more information about body temperature. So if I come over to the internet here, we'll just make that a little bit larger. One of the first things that I could do would be just to run a simple basic Google search and ask Google, what is body temperature? And as you can see, it starts to come up with quite a number of responses to this. So we've actually got a huge number of responses. Let's look at the top one. So let's go to that first. And this is a site called Webmd, which is a fairly public-facing site. It's aimed at members of the general population looking for information. It's not really specifically aimed at doctors here. And this will give us some fairly basic information. So it might talk a little bit about what temperature is, what temperatures might be normal, and how we might measure temperatures. Now, for starting off, that sort of information could be quite useful to us. As always, we'd have to check how accurate the information was, but it would give us a reasonable starting point. But over the course of the next sort of 5 years, we're hoping that you're going to develop knowledge and just kind of searching experience beyond that. So let's go and look at some other sources. One of the common things people will do is to go to a site like Wikipedia. Now, Wikipedia is often quite a good resource for information. It holds a lot of information. It can be very, very up to date and be ahead of things like textbooks and other sources. But as it is publicly built and it's effectively crowdsourced information, there can be a lot of inaccuracies there. So this may give us an overview, but actually we'd want to see whether what Wikipedia is telling us is actually something that's backed up or not. And if we look and we go to some of, say, the citations here, we may want to look at actually following these links to work out whether the things that Wikipedia is telling us are actually true or not. So as you can see, this references Harrison's Principles of Internal Medicine, and we may want to go back to kind of check the veracity of that information. There are lots of other sources that we could use. So we could go to the library. We've got our medicine and health subject room here, so we could use this to search for lots and lots of pieces of information. And if I just go to a simple kind of library search and click here, and then if I was to, as I've done with this, put in a request for information on body temperature. And as you'll see again, I've hit a huge number of responses. There are lots of things, but I suspect that references to hibernation in black bears or Mesozoic marine reptiles probably aren't going to be that relevant to the questions that we've been set. If we were set a question on reptiles, they may well would be, but I don't think in this case that's very likely. Now, we have got up here a book on body temperature regulation, which we could look at. We could go to the library, we could take out, we could read. However, that is probably going to contain a huge amount of very, very detailed information, and that may be not to the level that we would want to answer these questions. Because this is probably a question about physiology, we could move over to look at some of the physiology textbooks here, and there are many of them available in the library. These are just a couple of them, and some of them are able to have online access. So actually, if I click here and come through, I will start to pull up the ability to download a PDF version of the textbook. I've got it open here, and this will allow me to save this for a limited amount of time to my iPad and to read through it. Now, this is going to have a lot of information on different points of physiology, so it'll cover things like cardiac physiology, renal physiology, and lots of other things as well. We're going to have some sort of strategy for searching within this. It may be using search functions, it may be checking through for the relevant chapters, and then looking for the bits of information. So these can be really useful resources, but they can also be quite time consuming to work through and find the piece of information we're looking for. The benefit to that is that if you spend time reading through a resource, you're probably likely to pick up lots of other pieces of information that will eventually be quite relevant to you. We don't just have to stick with what's available in the library. We can do simple searches again, and there are lots and lots of sites that will offer textbooks that are available online. So again, going to the top resource on this one, and I can pull out exactly the same textbook that I was just looking at from another source. And there are many books available online and open access these days. Again, with any textbook that you're going to download, it's got the same issues of having to find the information within it. Other things we could do would be to move to more sort of generalised information sites. The Khan Academy hold lots and lots of information and tutorials, some of which is specific to the study of medicine, some of which is a bit more general. So if I look for temperature regulation on the Khan Academy, just go to their website, khanacademy.org, I can find lots and lots of things that may start to be useful. So we could look at why lizards sunbathe, why rabbits have large ears, how do polar bears use their coats to stay warm. All of these things may be useful to us. There's a lot of similarities in physiology across different species, but there are a lot of differences as well. This might provide us with some nice background, but it may well not help us to answer the question that we've been set. The Khan Academy also has a lot of information available when it comes to sort of more specific stuff. So if we can look under health and medicine, we can find lots and lots of topics. So we could look at circulatory system physiology, circulatory system diseases, and there's lots of podcasts and videos in these type of topics that are very useful. They might not help us to answer this question if there isn't one that covers the topic that we're interested in, but it might well help us with other problems further down the line. There are also more sort of specialised sources of information aimed at health professionals. So Life in the Fast Lane is almost like a sort of medical blog site that contains lots and lots of information, particularly around emergency medicine. So I've just searched here for body temperature as a general search term, and again I've got lots and lots of results. Now these are quite useful results if we were looking at something like the topic here of targeted temperature management after a cardiac arrest. How do we think about potentially cooling patients and rewarming patients? What sort of changes I would have in tracings of their heart depending on their different body temperatures. And for maybe sort of some of the clinical medical students, this is really useful information, but at the moment it probably doesn't quite answer what we're looking for here. Some of the other kind of more focused sites for medical professionals would be something like GP Notebook, which is open access, although you do have to subscribe to get to more than 3 pages a day. And this will often have a lot of very useful information which is kind of stripped down and targeted at doctors. It tends to be good for a quick look at something. It'll have lots of links to other pieces or other pages within the site that'll help you to develop that knowledge. Some of the articles may be slightly more aimed at clinical medicine and some of the students further on in the course, but there are also likely to be bits of information that are more useful at a earlier level in your training. These sort of pages are usually quite good in terms of accuracy, but as you remember, with all the information that we're accessing on the internet, we are going to want to make sure that we're checking some of the sources that they cite and we're checking that that's going to be accurate. One strategy that's become more open in the last few years is that we could start to crowdsource our information for ourselves. So here I've got the Leicester Medical School Twitter page open, and I could ask Twitter how we might assess body temperature, and I'm probably going to start to get some answers back from this. We could do this similarly with other sites of social media, such as Facebook. However, as always, we have to start thinking about the accuracy of the information coming back to this. If you put stuff out into the public domain, anyone can answer this, and we would be having to check whether the answers that we were getting back actually reflected the reality of what we're looking for.